Hi, I'm Jean Schumacher. I'm founder of simplyplantbased.net, where there's lots of resources to help you on your plant-based journey, and co-founder of the Pregnancy Advantage, where I help women to get their bodies pregnant ready, along with Dr. Deborah Shapiro, who is a plant-based OBGYN. And today we have an amazing guest, Dr. Saray Stancic, who is the author of What's Missing from Medicine book, producer of the documentary Code Blue, and is director of medical education for the Physicians Committee for Responsible Medicine to promote preventative medicine, better nutrition, and higher standards in research. And boy, did they get the right person. Just saying, just saying. Thank you so much, Dr. Stancic, for taking the time to be here with me today.
Thank you, Gina. It's a great pleasure to be with you.
Well, MS, big one. Okay. As a third-year medical student, you were diagnosed with multiple sclerosis. It had a huge impact on your life. And we're going to hear that story because that is like, whoa. But let's start with the basics. What is MS or multiple sclerosis?
So MS is an autoimmune disorder that attacks the central nervous system. And essentially what happens is your immune system, which is supposed to fight off foreign invaders like bacteria and viruses, instead starts to attack self. And in multiple sclerosis, it attacks myelin, which is the fatty sheath that protects nerves.
Okay. Well, share your story because, boy, it's a big one. It's powerful.
Sure. So on October 11th, 1995, I was a third-year medical resident, and I was on call at the hospital, and it was a very busy night, Jean. I was running from the emergency room to the ICU. And it wasn't until sometime in the mid-morning hours where I finally found an opportunity to take a nap. The minute I got to that room, I fell asleep. I was so tired. And shortly thereafter, I was paged to address another urgent matter. When I tried to get up out of that sleeping position, I found that I couldn't feel my legs. Panic set in. Next thing I knew, I was in the emergency room. An MRI of my brain and spinal cord were conducted, and that confirmed a diagnosis of multiple sclerosis. And I had multiple lesions in both my brain and spinal cord. And so everything changed for me on that one day.
Yeah.
So that was a meaningful moment in my life that certainly put me on this path of chronic illness patient, but it also had a significant role in changing my professional path moving forward.
For sure. I mean, did you, were you treated first with drugs? How did you get?
So at the time when I
connect the dots.
So when I was diagnosed, I was immediately started on a disease-modifying therapy. At that point, there was only one drug that was approved by the FDA called beta-seron. And it was a drug that had a lot of side effects. And it was a drug that I had to inject every night. And of course, at the time, my doctor said to me, if I don't start this medication, I'll likely be in a wheelchair within 10 to 20 years. And he said, this was your best chance at slowing the progression of the disease. So of course, I was going to do whatever I needed to do to assure that I could extend my ability to remain free of disability. So the medication, regrettably, had a significant side effect profile that then led to prescriptions for other medicines to treat the side effects of the side effects of that drug. So I found myself, Jean, within a few years, taking about a dozen medications. And despite all of the medicines, my disease progressed and my quality of life suffered immensely. By 2003, I was taking 12 medicines and I was dependent on crutches or a cane. And then I say 2003, so this is 8 years into my diagnosis because it was when I had what I call my aha moment. And it was a peculiar aha moment. So envision this, I'm a dual board certified attending physician, right? I'm chief of infectious diseases, and I know nothing about food because I wasn't taught anything about this, right? But I came across an article that discussed the connection between multiple sclerosis and diet. And I was sort of struck by this because I hadn't learned anything about it. And in this publication, there's some suggestion that diet has a significant effect on multiple sclerosis. And I was curious as to why my doctor, who was like the leading expert in MS, didn't really ever ask me about my diet and how it was that I as again, a dual board certified attending physician, didn't know anything about diet. So it was that moment in time that really started to connect the dots for me, that diet plays a significant role in disease formation. And so as I delved into the literature in 2003, I was just, there was this great level of excitement that arose within me, like this could be, there's some hope here. Because I was doing whatever my doctor asked me to do. Again, I was taking those medications, I was being compliant. And despite that, my disease was worsening. And I had lost hope. So this offered me hope. And so in 2003, empowered by all the literature that I had consumed, I implemented change. Literally, yeah. I implemented these changes in my life. So I adopted a plant-based diet. I began to exercise. In the 1990s, we were falsely advised not to exercise. It was falsely believed that patients with MS, that exercise could exacerbate the disease. So I hadn't done anything for many years. And so the best I could do is to get onto a stationary bike supported by my husband. I could do a minute or two and then exhausted and in pain, he would carry me off. But every day I'd get on. And over time, I built strength and endurance. I addressed streams of stress in my life. I brought my team together at the VA and I said, I'm not going to take on that extra research project or that extra clinic time. I was going to put myself first for the first time in my life. I learned how to sleep, Jean. Wow, that was a big one. I was addicted to Ambien. My doctors freely prescribed that for me, or Ativan, a benzodiazepine. So I had become dependent on these medications and I didn't know how to sleep. So I learned and understood sleep physiology, the importance of environment, pre-sleep rituals. And I created this really wonderful sleep habit. And it didn't happen in a week or a month, but over time, I started to feel better. At first, it was something as subtle as I could stay up past Jeopardy. Or on a particular day, I remember getting to my office and feeling confident enough on that day to leave the cane in the car. And again, I went from, not to belabor the story, but I went from that young woman who was dependent on a cane and 12 medications to someone a few years later crossing the finish line at a marathon free of medication. And today, it's been 26 years since my diagnosis, and I'm medication-free and disability-free. And that's what fuels my passion to educate community and my peers. Because, Jean, one of the most remarkable conclusions that I drew was, how could it be that I, again, as a practicing attending physician, knew nothing about the importance that lies on our plate? And that's not because I was negligent or I wasn't interested. It was because I wasn't trained this way. This wasn't taught to me in medical school. And that needs to change, because the most important factor, the most important therapeutic intervention we have in our toolbox, in our doctor's bags rather, is our diet. And doctors don't know this. And so my passion is to correct that wrong, is to go out and assure that every physician, every medical student, every pre-med, anybody who's interested in the field of medicine, both physicians, and we want to expand that out to nurses, all healthcare professionals, anyone who is in contact with a patient in our healthcare system needs to understand the power that lies on our plate and in our lifestyle choices, the decisions we make each day. Are we sedentary or are we active? Are we managing streams of stress in our life? Are we sleeping effectively? Are we drinking or addressing issues of substance abuse? And importantly, are we connected? Social interconnectedness is so important. We know those amongst us who are isolated or depressed are more likely to develop a chronic disease and die prematurely. So for the past 15 years, I've been wholly dedicated to educating and disseminating this this simple but very powerful message to whomever is willing to hear it. So I appreciate the opportunity to share it with your audience.
Well, and I'm so grateful that you're doing that, because just like, duh, I mean, it makes so much sense. Like, if you're putting kerosene in a regular car, is that car going to run? No, the car has more sense than the human body. The human body, an amazing machine. It tried valiantly to deal with whatever crap you're putting into it, food-like substances, and you expect it to run and run well, and it's not. It can't. And how could you not even know like that what's going in is going to have an impact on this high performance vehicle? I mean, like, seriously, come on.
Yes.
Come on. Like, I don't know. It just, I've even had doctors say to me, like when my thyroid was starting to go, oh, well, first of all, you can't heal that, number one. And no, food doesn't have any impact on that. Really?
Right.
Honestly.
And it's simply because it's just not covered. It's not discussed in medical school.
No, it is not discussed. It is not. And that's what makes me crazy. And I'm so grateful that PCRM, you are like the perfect person to be doing this. So thank you so much for getting the message out, because like, I think there's two kinds of doctors. Either you are not with it and you haven't read the research,
Right.
Or you've read the research and you're like, yeah, no, that we got to do this. So and start implementing it. There's two types of doctors. That's it. You haven't read the research. That's it. You stuck your head in the sand. Anyway, all right. So what are some of the symptoms of MS?
So some of the symptoms of MS are, for example, numbness and tingling. That's something that's very common. Weakness, issues with balance. It can certainly affect your bladder. The most common symptom that MS patients report is fatigue. Mm-hmm. And that's a big one, right? I can tell you that for me, I had mentioned earlier that one of the first improvements that I noted was to stay up past Jeopardy. I know it sounds sort of silly, but I can tell you that by 3 or 4 o'clock, I felt this heaviness and I was just so tired. So the idea that I had this new energy, this ability to expand my day and get more things done and enjoy my family and friends was just an incredible blessing. So multiple sclerosis is a very difficult disease. There's a spectrum, no two patients are the same. So it's really important that, it's hard to say if you have this diagnosis that you're going to get this set of symptoms. Everybody's different.
Yeah. Well, there's different types of MS, and how do you know which one you have?
Yeah, so there's 3 primary types. The first is relapsing remitting, and that's the most common one. I think about 85% of patients that have multiple sclerosis have relapsing remitting. And what that means is that you have an event, right? What we call an exacerbation. So you might wake up and you might have a blurry vision, which is something we call optic neuritis. But then it gets better over time. So it relapses and remits. Other patients might be diagnosed with something called primary progressive, where they have an event and it never really recovers. It just continues. There's accumulated disability. And then there's secondary progressive, which is usually what follows after relapsing remitting. So many patients will be diagnosed initially with relapsing remitting, and then they will evolve into secondary progressive, meaning they never recover from an event when symptoms present themselves. Let's say they have a weak left leg. If you're relapsing remitting, it will get better. With secondary progressive, it never improves. It just continuously accumulates and worsens.
Well, okay, here's the $1 million question. What causes MS?
That's a great question. And it's really not clear yet. There are a lot of theories as to what might be causing MS. For example, we know that there's a geographic distribution that folks in the north are more likely to have MS than others. And so as you get closer to the equator, you're less likely to develop MS. So one of the theories is that it's vitamin D levels. So folks that have very low vitamin D levels are at increased risk of developing multiple sclerosis. That's one theory. There are some infectious agents that viruses, for example, like HHV6, herpes virus number 6, EBV, Epstein-Barr virus is another one contender that there are some theories to suggest that might be the culprit. Other things like obesity, smoking is another variable. There could be some genetic components that are contributing to increase, but no one's really been able to definitively define what is the cause of multiple sclerosis to date.
Okay. Well, how does the location of multiple sclerosis lesions affect how the disease manifests?
Yeah, so it primarily, you can see lesions either in the brain or spinal cord. Typically in the spinal cord, you'll see symptoms like, numbness and tingling and weakness in the extremities. Whereas when you see lesions in the brain, they're more likely to be balance issues, proprioception. There might be some, issues with like remembering things and your ability to find the right word when you're speaking to someone. So you'll see more symptoms like that. But for example, if you have a lesion in the spinal cord, you're more likely to have what we call like the numbness and tingling types of symptoms and complaints.
Okay. Well, how are these lesions formed?
So what happens is your immune system attacks myelin, right, which is that fatty sheath that protects the nerve and allows conduction of the nerve signal to go smoothly. So when myelin sort of when the immune system pops holes in the myelin, you get this disruption. And so the nerve conduction is compromised. And so that leads to symptoms. Okay.
And you talked a little bit about bladder dysfunction. What kind of bladder dysfunction are we talking, and what can be done to help that?
Yeah, so bladder, again, it's the same thing because the bladder is innervated by nerves, right? So when you're affecting the ability for nerve conduction to be effective, or rather it's compromised by autoimmune disease. So what can be, typically patients will have retention or they'll have urgency. And there are medications that we can use to treat that. But obviously, the most important thing is to slow the progression of disease and interrupt that process, right? We don't want the immune system to attack and destroy that myelin. So we want to keep that myelin healthy. So the best way to do that is to, everything that we've just talked about, optimize every aspect of lifestyle. And I will say this, I personally don't take any medications, and I haven't required any medication. But with that said, there are some instances where medications need to be used. And so they ought to be used. And that is a decision that should be made with your physician. But, medications have a role. But what we want to do with plant-based nutrition and lifestyle medicine is always reduce our dependency on medications, because every medicine potentially has a side effect, as you know. And so we want to optimize every aspect of lifestyle to reduce a likelihood of disease progression.
Right. Well, constipation seems to be another issue in MS patients. So what about that?
Well, same thing. The bowels are innervated by nerves, so that can affect your ability to have healthy GI tract. So it's really important that, again, when we consume a plant-based diet, we're going to slow the progression of MS, and we're going to consume a lot of fiber. And fiber is such an important part of maintaining a healthy bowel movement schedule. And the other really wonderful thing is in multiple sclerosis, and we're learning a lot about this and in many autoimmune diseases, one of the questions that it's been hard to understand is how can an autoimmune disease that attacks your brain and spinal cord improve by eating a plant-based diet? Well, we have some ideas as to why that is. When we eat a plant-based diet, we're consuming a lot of fiber and a lot of these antioxidants and phytonutrients. And what we've learned is that we have this organization within our gut called the microbiome, right? So we have these diverse bugs. When we eat a diet rich in fiber, we're actually feeding the good bugs, right? So we have some good bugs and we have bad bugs. When we feed the good bugs in return offer us a wonderful thing. They produce these short chain fatty acids called butyrate, these signals that then communicate with the immune system and essentially tell the immune system to quiet down. And over the past several years, we've seen several studies that have shown that in multiple sclerosis And in other autoimmune diseases like lupus and Crohn's disease and ulcerative colitis, we see that patients improve when they consume a plant-based diet, because the plant-based diet is modifying the makeup of the microbiome to favor the good bugs. And the good bugs produce these good signals that then tell the immune system, stop doing that, and let's maintain a healthy immune system. And so patients symptomatically report that they feel better.
Oh, no, it's so true. It's so true. And fiber, we're learning, is so much more important than we ever knew.
Yes.
So, yeah. And just to see, like, I did an interview with Dr. David Denaev on his, he calls it the life smoothie, and phenomenal amount of greens and, phytonutrients and all of this. He did some studies showing, he used the C-reactive protein as one of the markers.
Yes.
In 7 days, it came significantly improved,
Wonderful. Yeah.
So
CRP is a marker of inflammation. Yeah.
Yeah.
Wonderful.
No, for sure.
Yeah.
Oh, so, okay. You go to a doctor, you get diagnosed with MS. What is the typical treatment that a mainstream doctor is going to say for MS?
Yeah. So it's this disease modifying therapies. And I think there are, again, when I was diagnosed in 1995, there was only one drug approved by the FDA. I think we surpassed 20. I think there's 20 or 23, something like that. And essentially what these drugs do is they quiet the immune system, right? So they're what we call immunosuppressive drugs. Because again, it's the immune system that's sort of excited and lit up and it's attacking, it's doing damage. So the treatments that are offered and that are approved by the FDA are quieting the immune system. But the only problem with that is, yes, you'll quiet the immune system, but then the immune system also has an important role, right? It's supposed to protect us. And so if you have a compromised or suppressed immune system, then you're at risk of other things, right? Like potentially infections, or the other role that the immune system has is to pick up any foreign invaders. So for example, if there was a precancerous cell, the immune system, when it's normal and healthy, will go in and attack it and make sure it doesn't grow, right? So when we have compromised immune systems, we're at risk of developing other complications. So that's why the disease modifying therapies, although they may quiet the attack on the immune system, you're compromising the positive aspects of our, maintaining a healthy immune system. And we've also seen, for example, we're living now in the midst of this COVID-19 pandemic. Individuals that are on immunosuppressive drugs are at greater risk of developing COVID-19 if they're exposed to it. And even with vaccinations, we've learned that if you are on an immunosuppressive drug and you're vaccinated, your immune response to the vaccine may not be as effective. So you still may be at increased risk of developing COVID-19.
It's like you're tying up your defense system in your body. It's like you're literally, shackling the guys who are going to help defend you against something attacking your body, and you're tying them up.
Right.
Well, what could possibly go wrong?
What we want to do is help our immune system to understand, because think about it, in an autoimmune disease, your immune system is confused, right? It's attacking you. Why is it doing that? We want to rectify, we want to re-educate our immune system. So those antibodies and those T cells and B cells that have gone, they're confused. They're doing the wrong thing. They're attacking the wrong foreign invader. We want to re-educate them. And it sounds to me like a really good way to do that would be to optimize our lifestyle.
Yeah, because my husband was diagnosed with MS, full disclosure. And, if you go to the MS website, all they talk about is living with MS. We didn't want to live with it. So can it be reversed?
Well, I think the question you're asking me, can it be cured, or is that what you're asking me?
Can it be reversed? If you have MS, can it be reversed?
Yeah, I think that it can be well managed. I think progression can be, I never say I'm cured of MS. I have a lot of respect for this disease because it's a disease that you can feel great one day and the next day, the floor falls out from under you. So I'm very careful to use the right terminology here. I can tell you that today I feel great and I'm asymptomatic. And it's been 26 years since I was diagnosed. And in fact, I just celebrated, or rather commemorated 26 years on October 11th, 2021. And on that day, I ran 26 miles. And every year I do this to celebrate the fact that I'm still moving. I was told in 10 years, I would likely be in a wheelchair. And so every year that I celebrate that I'm not, and then I'm, able-bodied is a win. There's a lot of questions that we don't have the answers to yet. But here's the thing, and I say this to my colleagues who are neurologists and they're experts in MS that still haven't warmed up to the idea of plant-based nutrition or lifestyle. I say to them, what's the downside here? What's the downside of advising your patients to consume a healthful diet and to engage in healthy lifestyle behaviors? Because here's the thing, even if it doesn't, let's play devil's advocate, even if it doesn't improve your MS or reduce progression of your MS, it's going to help to reduce risk of obesity, diabetes, of cancer, breast cancer, prostate cancer, Alzheimer's disease. There's so many benefits to this. Just the fact that eating a plant-based diet will allow you to be leaner. I think you told me you have a pretty spectacular story that you lost 100 pounds, right?
Yeah.
So think about it. The fact that you're
and
not
kept it off without dieting.
Right. So we're consuming and we feel satiated, and it's not like you're eating. Remember back in the day, if we wanted to lose weight, we ate carrot sticks and celery sticks and rice cakes. Do you remember that? And we drank Tab and Diet Coke. It was terrible.
Yeah.
We tortured ourselves. We didn't know. We were just eating the wrong foods. We were eating these calorically dense foods that had no nutritional value, no fiber, which is what offers us satiety. And it's powerful when it comes from a physician, right? So imagine if every MS doctor, even if you want to discuss the disease modifying therapy and offer that to the patient, here's the risk and the benefit, let them make an educated decision on that. But my goodness, it's so important for us to speak to the power that lies in lifestyle ubiquitously and unanimously, regardless of the diagnosis. Every patient that comes in for a visit should hear those words.
You think?
Imagine imagine if we all did that. If all of us in healthcare spoke to this, we could prevent 80% of the diseases that we see every year, every day here in our country. We just recently in October had October, which is Breast Cancer Awareness Month, right? And this is a topic that is incredibly important to me. And I talk about this in Code Blue and interviewed Dr. Graham Kolditz, who's an expert in breast cancer, has been studying it for 40 years. And throughout the entire month of October, Jean, we talk about breast cancer awareness, and everyone wears pink, and we bring a lot of attention to it, which is great. And football players wear pink, the NFL, wonderful. But no one talks about the importance of diet in preventing breast cancer and the importance of our lifestyle. Everyone talks about mammography, which of course is important and should be part of what we're doing. But imagine if we were to communicate these messages to women early on in life. We know that risk begins at menarche. So what if we went into high schools and grammar schools and started to talk to girls about the importance of their dietary choices very early on? Dr. Kolditz in the film says to me, if we get young girls eating a plant-based diet early on and maintaining a healthy weight and avoiding alcohol and exercising regularly, if we do that, we could prevent 50% of breast cancers. 50%. That's amazing. You think we would put a lot of effort and invest a lot of time into educating our young girls. And
there's no profit in that. You know that, right?
I know.
And that's the sad part about this. I mean,
we need
honestly,
to make it profitable.
I know.
We need to make it profitable to prevent disease.
It's just mind-boggling to me. I mean, because, okay, we got to talk about the legend. We have to talk about him. Roy Swank. Who is he?
Yeah.
What did he accomplish? And when did he do this?
Well, Roy Swank is a very important figure in my life. It was in 2003 when I was doing that research. He was the first publication so when I typed in words multiple sclerosis and diet, the first article that came up during my research was Roy Swank, and it was a publication from 1952 in the New England Journal of Medicine. And in it, he writes about the incidence of MS in Norway, which has one of the highest rates of MS in the world. And he notes, as he studies what's happening in Norway, that the highest concentrations are occurring in the inner farming dairy community, where they're consuming a lot of saturated fat. And so Swank in the 1950s, Gene, hypothesized that saturated fat was playing a role in the pathogenesis of multiple sclerosis. And he didn't leave it at hypothesis. He actually started treating patients with MS with a low-fat plant-based diet. And he followed a large cohort, and over 34 years, 140 plus patients at the end of the 34 years. And he reported his findings in the journal The Lancet in 1990. And he concluded that those patients that consumed the low-fat plant-based diet, they had significantly less morbidity and mortality, and 95% of them remained disability-free after 34 years of MS. When I read those words, 95% remained physically active, they jumped off the page and just infused me with, wow, lots of energy. Could I do this? Is it possible? Could I prevent this path that's already been inscribed by my physicians, that I will end up in this wheelchair? Could I do something? Could I choose a different path? Could I gain some control? And he was the first article, but it wasn't just him. There were several other publications, Canadian studies, European studies, that aligned with his recommendations. And that was really what fueled my commitment to a plant-based diet.
Right? I mean, and why is there no mention on the MS website of Roy Swank? Why?
I think, I don't know. The concerns with the Swank study were that he didn't have a control arm. He didn't report a control arm. So I know, but that's where we are. In clinical medicine and in science, we want randomized clinical trials, but those are hard to conduct in nutrition. So we often have to look at observational data. Listen, when we look at, for example, I know you're familiar with blue zones, right? Mm-hmm. Blue zones are communities in the world that have a large percentage of centenarians, so people who are long-lived and well-lived, because there's a very big difference between living a long time and living a long time in a healthful fashion, right? So we can, in the United States, we can keep you alive for a long time, but suffering. Yeah. And that's not what
we're
want,
not
right?
Living longer, we're dying slower.
Exactly. And so, right. So my goal for each and every one of us is that we age gracefully, that we're able to do the things that bring us joy each and every day. So on that last day on planet Earth, we're surrounded by our family and friends, that we're free of dementia, that we're able to enjoy their company and share a beautiful plant-based meal. And on that last day, you go to bed, you fall asleep, and you peacefully pass, right? So there isn't that bookend of suffering, which has become so normalized in our culture, that we all have to end up in an ICU or in a nursing home wearing a diaper, contracted and suffering and demented. That should not be the norm. No. We're all going to die. That's inevitable. But we need to choose our circumstances. And I think we have, in many cases, the ability to do that.
Honestly, I mean, the information that Roy Swank has already shown over like 3,000 patients. I mean, stop it. You want a randomized control study? Stop it. Stop it. We have the evidence, like right in front of you. Jury, go out and deliberate. Really? We want a double-blind, placebo tested. Oh, stop it.
It doesn't translate.
It infuriates me. It really does. I mean, I understand as a person of science, I get it. Control, variable, factors. We want it to be able to pull that information out to see cause, effect, independent variable, dependent variable. I get it, but stop it. I mean, really, when you stop and look at this high performance vehicle and the changes that can happen, this should be being beaten from the treetops. And if it's not, it's just, to me, just unacceptable. It just really is. Sorry, I'm on my soapbox right now. And it makes me crazy Because we know that what the right diet is for humans.
I think we do. I mean, there's a lot of it. I had mentioned the blue zones, and I just want to point out, although they're very distinct parts of the world, they're all doing the same thing, right? They're eating primarily plant-based diets. They're communal, so there's support. I mean, all of the characteristics that are consistent with a long-lived, well-lived life, they're all practicing it. So they're great examples for us to follow.
For sure. Because I just moved up to Cape Cod. I want to be kayaking, hiking, biking. I mean, I just want to be out there moving and doing until the day I pass from this planet. And that's what I plan to be doing. So
wonderful. You're a great example for us.
Well, it's just, this is my happy place up here, and I want to be out and enjoying it, because like, if you look at the different environmental, coastal, the biomes, the ecosystems here, it's incredible. Just incredible. Yes. I could wax poetic about Cape Cod for a long time, but anyway, so what's the outlook for MS? I mean, doctors talk about stem cell, genetic research.
Yeah.
But I think we've already talked about a better way. I mean, if somebody came with you with a diagnosis of MS, what would you recommend for them?
Well, I think everything that we've just talked about, this is important, not just if you have MS. We should all be doing this. If we're sick, we should be doing it to help better manage and even potentially reverse our sickness. And if we're not sick, let's do this just so that we can prevent that sickness, right? This is a win-win for anyone that engages in it. And also, I'm a physician, and I talk about the importance of plant-based nutrition because of the health benefits. And I'm looking at it from my medical perspective, but it's also wonderful for our environment. It's wonderful for animal welfare. So it's a win-win-win.
The animals are going, yeah, this is good. Keep it up, Because I watch those movies, and in my heart, I can't watch them. I can't. It just kills me. It just really does. I mean, to see what we're doing to these beautiful animals, and why we can say some animals are going to be like pets in our house, and we love them to death, and when they die, I lose it. But then other animals, we're just going to kill them and eat them, and it's like, what? So I don't understand that. And I love Dr. Barnard's, the bunny test. Put a bunny next to a baby and see if they go, oh, bunny, or is that like, do they sit there and go, how am I going to eat that? It's like, yeah, duh. Kids get it. They do, and they understand.
Well, I'm glad you brought up Dr. Barnard, because he's very special to me. He was the first person I invited to be part of Code Blue. He's always been such an incredible supporter. And Jeannie, years ago, we had I don't know if I shared this with you previously, but we had a Burger King restaurant. That's one of my other initiatives, is assuring that hospitals are healthy food environments. So we had a Burger King inside of our cafeteria at our hospital, and it's been there for 25 years. And I made great efforts to try to bring attention to the absurdity that a Burger King was in the four walls of the restaurant, of the hospital. I was largely ignored, and I was told that the contract could never be broken. And then I reached out to my dear friend, Dr. Barnard, in 2014, asking for his help. And he helped me with the team at PCRM to retain a copy of the contract. And I learned at that time that the contract could be broken in 2020. And so then we started a petition, and we held a protest supported by PCRM. And in 2020, that Burger King was removed from the hospital. It's no longer there. And it's largely because of Dr. Barnard and PCRM and this wonderful organization who's always been there to support me in every step of the way. And I just recently started working for Dr. Barnard and PCRM and in furthering his mission. So I feel so blessed to be part of this extraordinary team who's really doing so much to make the future of our country and of the globe healthier.
Right? I think of him as a knight in shining armor, except he wears a white lab coat.
I agree with that description.
He is just such an amazing
very special
man. He is truly one of the most incredible. His heart is as big as the Grand Canyon. I mean, he's just such an amazing, amazing man. And if you've not seen any of the videos I've done with him, please do check out on my YouTube channel. There's a whole series, especially from his 3 books, Your Body in Balance, The Cheese Trap, and Power Foods for the Brain. An amazing series with the author. Incredible. We dive deep into it. Oh, but he's just so wonderful.
Wonderful. It's a great organization, Jeannie. So I would invite everyone to look at pcrm.org. We have so many resources to support patients who are interested in adopting a plant-based diet and don't really quite know how to get started.
And you have plant-based telemedicine too, that you can connect with some of the doctors and dietitians, to help you to plan your diet out, to help you plan and make the transition. And you guys are doing jump starts all the time. There's so many resources. Yep. And Food for Life, there's the Food for Life instructor program. If you want to, you really want to dive deep into this and help within your community, you can get certified and teach within your community these practices, because we have to bond together. We do.
Yes.
We have.
And for doctors and healthcare professionals, we have a wonderful website called nutritioncme.org. You have access to free resources. We have a wonderful nutrition guide that is being updated weekly. So I invite all of you to take a look at that. And they're wonderful resources. Again, free and available to all.
Right? I like free. What's not to like? I like
Me
free.
too. Sounds good, right?
Right? No,
Yeah.
I mean, we have to bond together. We have to let people know that these resources are out there, that they're available, because like I said, either you are a doctor who's read the research or you haven't. End of story. And once you read the research and you open up your eyes, you're like, whoa, it's an amazing. But I think, we also are dealing with a very complex society, food addiction. I know I'll be the first to go, hi, I'm Jean Schumacher. I'm a food addict. I feel like I should stand up and say that. And, and it's taken a lot for me to overcome my food addictions and to, retrain my brain. Because and that's part of it is like, can you eat just one potato chip, especially Cape Cod potato chips? Just saying. Whoa.
Those are good. Yes. Well, it's regrettable. Our food system has created these hyper addictive foods, right? And they know what they're doing, right? They're layering these processed foods with sugar, salt, and fat, and they know the brain can't. Well, you're a scientist,
Michael Voss, read the book.
Yeah.
Read the book. I compare it to exactly what they did with tobacco. In the beginning, we couldn't inhale tobacco very well because it was like harsh and like our lungs were going, what is this crap? And so what they did is they started coating it with sugar. They coated the tobacco.
Oh, I didn't know that, actually.
Yeah, that was a step one. They coated it with sugar to make it more palatable so we could inhale it, easier.
A little deeper.
A little deeper and inhale it better, without going all over the place. And then the next step was, if that wasn't bad enough, then they started adding additional amounts of nicotine to it to make it even more addictive to you. Like, really?
That's the same thing that's happening with these food scientists.
Exactly.
Large corporations where they're producing these foods that they're keeping you addicted. There's a reason why you can't eat one Oreo cookie. And it's not you. It's not that you're weak. It's that this food has been produced this way to keep you addicted. So I think as we educate people, I hope the idea is that they push away from this, that nobody wants to be controlled by an outside party. And what we need to do is return back to the earth, right? Go and eat these foods, these whole foods.
Grandma knew.
Yeah, exactly. Eat more like
your fruits and vegetables. Grandma knew. Back to the basics. Yeah, you're going to feel so much better. You're not on medication. You are not in pain. Because I look around at people like my age, they're walkers already. I have a girlfriend she's 3 days older. I constantly remind her of that. And so if you look at the two of us together, it's like, whoa, what happened? And she's already had quite a few strokes. She's got diabetes. And I started her after, I think the first stroke. I went over and spent a weekend with her. I brought forks over knives. I went and bought like $200 of groceries, and I brought some nonstick pans. I spent the weekend, taught her how to do this, and she did it for about 6 months. And then she ate a hot dog and it spiraled out of control, and she never got back on the bandwagon, even though she felt so much better. She was almost off all of her diabetic medications. Nope, went right back and spiraled out of control. And now we've had a lot more issues and problems. And if you look at the two of us side by side, you never know, we're almost the same age.
So hopefully she'll go back to it.
The power of food. It's that seduction. And I understand it, and it's not to say that I don't fall off the wagon. Oh God, please stop it.
Yeah. We all have moments. Yeah. It's okay.
But you get up, the very next meal, you make it okay.
Right.
And you get back on, and then you're on the right track. So yeah, it's you need help. And that's why PCRM is amazing, because they offer that help, that guidance to get you on this path, because it is the right path. And, I know personally myself, my husband's dealing with MS. I know your story is like, whoa, and just to help get this message out, please, whole food, plant-based, it takes care of a lot of stuff,
It sure does. It sure does.
Well, thank you so much for taking the time to be with me here today. I mean, you are truly a blessing to the plant-based movement, and PCRM has chosen perfect. They couldn't have found anybody better to be doing what you're doing. So thank you so much for doing this. And yeah.
Thank you, Jean. It was lovely to spend this time with you.